Frozen shoulder steals more than your movement. It steals your sleep, your independence, even the simple joy of getting dressed without pain. Today, I am sharing the 5 moves that take all of it back. Before we get into the moves, let me explain what is actually happening inside your shoulder. Frozen shoulder, doctors call it adhesive capsulitis, is when the tissue around your shoulder joint thickens and tightens. The shoulder capsule, which is supposed to glide and stretch, gets stiff, and the more it stiffens, the less you can move it. Here is what most people get wrong. They think frozen shoulder is just a senior issue. It is not. It hits hardest between the ages of 40 and 60. It is more common in women, and it is way more common in people with diabetes or thyroid problems. So if you are watching this in your 40s, your 50s, your 60s, or beyond, this is for you. And here is the good news. Physical therapy is the #1 medical treatment. Not surgery, not pills. The right moves, done consistently, can free your shoulder. That is what I call the shoulder reset. Before we dive in, drop a comment below. Tell me where you are watching from, your age, and which shoulder is giving you trouble, right or left. I read every single one. We are starting at number 5, the pendulum swing. The pendulum swing is recommended by Harvard Health as the very first stretch every frozen shoulder patient should do. Why? Because it gets your shoulder moving without forcing it. No strain, no sharp pain, just gentle, controlled motion that begins to wake up a stiff, locked-up joint. Here is the science in plain English. Inside your shoulder joint, there is a fluid called synovial fluid. Think of it as the natural oil that lubricates the joint. When your shoulder is frozen, that fluid does not circulate well, and the joint gets even stiffer. The pendulum swing uses gravity and gentle motion to get that fluid moving again, which slowly softens the capsule from the inside out. Here's the move. Stand next to a sturdy table or counter. Lean forward slightly from the hips. Place your good hand on the table for support. Let your affected arm hang down toward the floor, completely relaxed. Now, using your body, not your shoulder, gently start swinging that arm in small circles, about a foot wide, 10 circles one direction, 10 circles the other, then swing it gently forward and back, then side to side. That is 1 full set. Aim for 2 sets a day, morning and evening. Do not power the swing with your shoulder. Let the arm hang heavy and let your body's motion do the work. This move starts restoring the most basic forward and side motion your shoulder needs every single day. Reaching for a coffee cup, opening a fridge, picking up a phone. It is small, it is gentle, but every single recovery from a frozen shoulder starts here. Now, before we get into move number 4, I want to give you something to look forward to. Stick with me all the way through. Right before we wrap up, I am sharing one bonus tip that most people with frozen shoulder never hear from their doctor. It is one small thing you can do before every single one of these moves, and it is what separates people who recover in months from people who stay stuck for years. Trust me on this one. You will want to hear it. Coming in at number 4, the cross-body stretch. This one targets the front of your shoulder capsule, and here is why that matters. In a frozen shoulder, the front of the capsule is one of the first places to tighten up, which is why reaching across your body becomes so painful. Grabbing a seat belt, putting on deodorant, hugging someone, all those motions cross the front of your shoulder, and when that area is locked, every one of them hurts. The cross-body stretch directly opens that front capsule. Done right, you will feel real release in your shoulder within the first week. Here's the move. You can do this standing or sitting, whatever is more comfortable. Take your affected arm and bring it across your chest at about shoulder height. Now, use your good hand to grab just above the elbow of your affected arm. not at the elbow joint itself, but on the upper arm just above it. Gently pull that arm closer to your chest until you feel a stretch in the back and front of the affected shoulder. Hold the stretch for 30 seconds. Breathe, relax, then release. Repeat 3 to 5 times on the affected side. Do not pull at the elbow joint. Grip just above it on the upper arm. And keep your shoulder relaxed, not shrugged up toward your ear. Every time you reach across your body, for a seatbelt, a passenger window, a doorknob on the wrong side, you are using the exact motion this stretch restores. Within a few weeks of doing this consistently, those daily moments stop hurting. That is real progress. That is your shoulder coming back to life. At number 3, the doorway stretch. This is the move that opens up something called external rotation. In plain English, that is the motion of turning your arm outward, away from your body. It is one of the first motions frozen shoulder takes away from you, and it is one of the hardest to get back. Think about all the things you do that need this motion. Reaching for a cabinet above your head, opening a door, putting on a jacket, combing the back of your hair. When external rotation is locked, every single one of those becomes a struggle. The doorway stretch directly trains it back. Here's the move. Stand in a doorway, bend the elbow of your affected arm to 90 degrees, so your forearm is straight out in front of you, like you are about to shake someone's hand. Now, place your forearm and palm against the inside of the door frame. Keep your elbow bent at 90 degrees. Now, keeping your forearm pressed against the frame, slowly rotate your body away from the doorway. Step your feet around. You will feel a stretch in the front and side of your affected shoulder. Hold it for 30 seconds. Breathe through it. Step back to neutral. Rest a moment. Repeat 3 times. Never push through sharp pain. A deep pull is fine, a stab is not. And keep your elbow locked at 90 degrees the whole time. Every time you reach outward and away from your body, to open a car door, grab something off a side shelf, give someone a wave, you are using external rotation. This stretch brings that motion back. And once it comes back, your daily life opens up again. At number 2, the towel stretch. Here is why this one is so high on the list. The towel stretch restores internal rotation. That is the motion of reaching behind your back. And out of every motion a frozen shoulder takes away, this one is usually the last to come back. Think about how often you reach behind your back without even thinking about it. Tucking in a shirt, reaching for a back pocket, fastening a bra, scratching the middle of your back, putting on a coat with the second sleeve. When internal rotation is locked, all of those become impossible. People with frozen shoulder feel this one the most. That is exactly why the towel stretch earns the number 2 spot. It works on the motion that is most stubborn and most life-changing when it returns. Here's how we can do it. Grab a small hand towel, about 3 feet long. Hold one end of the towel with your good arm up over your shoulder like you are drying your back after a shower. Reach the other end of the towel behind your back with your affected arm, palm facing out. Grab the bottom end of the towel. Now use your good arm, the one on top, to gently pull the towel upward. As you pull, your affected arm gets gently lifted behind your back. Pull only until you feel a stretch. Not pain, a stretch. Hold it for 20 seconds. Breathe. Then release slowly. Repeat 5 times. Do not yank the towel hard. Pull slow and smooth. And keep your top shoulder down, never shrugged up. Within a few weeks of doing this consistently, the motions you have been missing the most start coming back. Tucking in your shirt without pain. Reaching for your back pocket without a wince. Putting on a jacket like a normal person again. This is the move that gives you those moments back. And here we go. Number 1. The most effective move of all 5. The wall walk. Out of every single exercise in the shoulder reset, This is the one that brings back your overhead range. And overhead range is the holy grail of frozen shoulder recovery. It is what lets you reach the top shelf again, wash and brush your hair without pain, put on a sweater without that sharp, locked-up feeling, reach for the seatbelt above your head in a car. The wall walk earns the #1 spot because it is the most active move on this list. The first 4 moves work on opening the capsule. This one rebuilds full range of motion in the most life-limiting direction, straight up, and the progress is visible. You will literally see your fingers climbing higher up the wall over the weeks. That is not hope. That is recovery happening in real time. Here's the move. Face a wall. Stand about an arm's length away. Place the fingertips of your affected arm against the wall at about chest height. Now, slowly, walk your fingers up the wall like a spider crawling, inch by inch. Keep your shoulder relaxed. Keep breathing. Walk those fingers up as high as you can comfortably go, not into sharp pain, but into a real stretch. When you hit your limit, hold there for 10 seconds. Then slowly walk your fingers back down the wall to where you started. Do this 5 to 10 times in one session, twice a day. Do not shrug your shoulder up to reach higher. Keep it relaxed and let the arm climb on its own. And take it slow, not fast. Mark a spot on the wall where your fingers reach today. In 2 weeks, mark it again. In a month, again. You will watch your shoulder come back to life right in front of you. And when overhead motion comes back, the rest of your life comes back with it. Closets, cabinets, showers, sleep on your affected side, all of it. This is the move that brings you home. All right, I promised you a bonus tip, and here it is. Before every single one of these moves, you need to warm your shoulder up. I am not talking about jumping jacks. I am talking about real, gentle heat. A warm shower, a heating pad, a warm, damp towel. Apply it to your affected shoulder for 10 to 15 minutes before you start your routine. Here is why this matters so much. Heat makes the shoulder capsule more pliable, more stretchable, softer. When you stretch a warm capsule, you gain real range of motion. When you stretch a cold, stiff capsule, you fight against it, and you can even make it worse. This is exactly what physical therapists do in clinic. They warm the shoulder first, then they stretch. Almost every home program skips this step. That is the difference between people who recover in a few months and people who stay stuck for years. 10 to 15 minutes of warmth, every session. That is the secret most doctors forget to mention. So there it is, the shoulder reset. Move number 5, the pendulum swing. Move number 4, the cross-body stretch. Move number 3, the doorway stretch. Move number 2, the towel stretch. And move number 1, the wall walk, the move that brings your full range back. Warm up first. Stay consistent. Be patient with your shoulder. It did not freeze overnight, and it will not unlock overnight either, but it will unlock. If this helped you, hit like, subscribe, and tell me in the comments which move you are starting with today. I will see you in the next one.